In Canada, the call has gone out for the Chief Public Health Officer, Dr. Theresa Tam, to either be fired or resign. Her handling of the CCP coronavirus have come to light. This is the great one.
Dr. Theresa Tam, Canada's Chief Public Health Officer, must resign or be fired. She's in a terrible conflict of interest because she works right now for the China-controlled World Health Organization. I have a petition at www.firetam.com.
Okay, so the guy from the Rebel News is calling for the resignation or the firing of our Chief Public Health Officer. Now, I usually don't follow the Rebel News because I find them too far to the right, and they have mixed reliability on the media score. They're not exactly inaccurate, but they do sensationalize things a little bit to make it appear that it's worse, that someone's doing a worse job than it is. So I usually don't go with them, but when I saw this, I went, what the hell is this all about? Because I do see the Dr. Tam, she's on TV all the time, telling people to stay inside, wear a mask, all that fun stuff. So I thought, okay, I'll go with this. I'll see where it leads. So according to the Globe and Mail, she became our top doctor and was appointed to the head Public Health Agency of Canada back in June 26, 2007. Nothing wrong with that. And she was appointed by Federal Health Minister Jane Philpott, and she's the third person to head the Public Health Agency since its inception in 2004. Okay, so far so good. A pediatric infectious disease specialist and held a number of senior leadership positions at the agency. Okay, and she's been dealing with the growing opioid crisis in Canada. Okay, so that sounds good. Good credentials. But then they were mentioning that she belongs to the World Health Organization. So I went to the World Health Organization, and yes, she is a member of the World Health Organization. Mentions the same things: expertise with immunization, infectious disease, emergency preparedness, and global health security. Played a leadership role in Canada's response to public health emergencies, including SARS, H1N1, and Ebola. Doesn't say when she started at the W.H.O. And you can see it right here, the current members. There she is right there. She is on the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program. So this means that she sees the reports that come in. They access the performance of key functions in health emergencies, determine the appropriateness and adequacy of financing and resourcing, provide advice to the Director General, review reports on WHO's actions in health emergencies, review reports on the state of health security development by the Director General for submission to the World Health Assembly through the Executive Board and the United Nations General Assembly, prepare an annual report on its activities, conclusions, and recommendations. Now, I couldn't find any references to late 2019 or 2020. The last report is November 7th to 8th, 2019. So this means that when the first reports came out about the CCP coronavirus, she would have saw those reports, and when the WHO team went over, she would also see what they found. Now, people have got to understand that when the World Health Organization, they made a request to check up on this, the Chinese Communist Party. The CCP denied them at first, but then later they allowed them in. The CCP is a communist country, in the same vein that North Korea is, and that everything is going to be orchestrated. They're very good at putting on displays. When they denied the request the first time, it gave the CCP time to organize things to show China in a good light. Because that's all it's about. It's about face. The CCP cannot show weakness. What they would do is they would choreograph every little thing. So when the WHO team came, they didn't go to some random hospital out of nowhere and see people or take tests or anything. They were given a guided tour, basically, of what the CCP wanted them to do. And that is where the problem lies. And then they believed the reports from their colleagues within the CCP. So all the data they got was already doctored. And no one's ever really going to know how bad it really was. And Dr. Tam, she sees these reports, and she makes her recommendations based on those, knowing full well, and all these people should know, these are doctors. They went to university, they have degrees, they should damn well full know well that the CCP will lie and cover up. So that is on her. So as our public health officer, she also guides policy and directs our Minister of Health and Justin Trudeau on Canada's response to the CCP coronavirus. It's troubling when she spouts the liberal talking points and gives us bad advice during the pandemic. Lately, she hasn't given bad advice, but when this thing first came out, yes, she was. According to the Calgary Herald, Premier Kenny from Alberta says the criticism of Dr. Tam is well deserved. At the beginning of this outbreak, she was also touting the official CCP line where that travel bans were not necessary. She also said that it wasn't human-to-human transmissible. And she basically quoted all the CCP guidelines for what they were telling the WHO. And this became deadly for us in the early stages. According to Edmonton Journal, she was saying back in January 2020 that it's going to be rare. So she was completely off the mark in the early stages of this pandemic. She had only seen the World Health Organization reports and had no clue what was really going on in Wuhan. And despite all the mounting evidence, when the doctor who was the original whistleblower said that it was human to human, they didn't listen. They listened to the CCP party line, and that makes it disturbing that she would accept that at face value, especially in her position. So I think she should resign, even though she's changed her tune and is doing what she can, but she's clearly not capable of making an independent decision, obviously, and she doesn't have our best interest at heart if she does that. Instead of closing our borders and doing this and this and this and making sure we have enough medical supplies, instead of shipping them back over to China, we should be keeping them ourselves and making sure. This is from the Rebel. I haven't been able to verify this yet, but it appears that the Trudeau government gave hundreds of Canadian visas to Wuhan residents after the pandemic began. Remember, we didn't get Canadians out of Wuhan until during the Chinese New Year in January 2020. And this had already been going on since late November, early December. This virus had been spreading in Wuhan. So I haven't been able to fact check this one yet. But it wouldn't surprise me because Canada, we're trying to get all our Canadian citizens out of there. If they have any Chinese spouses or family members, then we would probably have given them a resident visa. Knowing how corruption works in a communist country, there would have been a lot of people applying for this. And the consulate would have been overwhelmed probably. So this wouldn't surprise me. So basically the Rebels saying that documents from Canada's Public Safety Ministry contain shocking statistics about the number of temporary resident visas issued to travelers from the CCP coronavirus epicenter, Wuhan, after China admitted to the outbreak. Still trying to find out if this is true. It wouldn't surprise me. So the question is, should Dr. Tam resign or be fired? She should probably resign. But who are we going to replace her with at this point? That's the problem. She should definitely be censored for this. So after this is all over, she should just resign. No ceremony, nothing. Someone who made a terrible mistake and then tried to help correct it when it was over. That's about the best I can come up with right now. So anyway, for all my fellow Canadians out there, let me know what you guys think about all this. It is disturbing that Dr. Tam is part of the WHO and dropped the ball big time on this. Anyway, until next time, this is Roman De Silvi. This was the Great White North Report.
I'm in love with the system.